The Old School is brought to you by Ahart Solutions, which provides school surveys and applied research. More information at ahartsolutions.com.
Good morning and welcome to the Old School Podcast, a podcast about the American education system and sundry. And with me in that endeavor is my good friend, Dr. Stephen Bourgeois. Good morning, sir.
Hey, Miller. How are you today?
I'm doing all right. It's not bad.
Okay.
I've been worse.
Yeah, I think we all have. One of, one of those days. I can tell you, though, I've been watching one of your favorite sports nonstop over the weekend. Well,
What do you think is one of my favorite sports?
I've been watching hockey. It's
Oh, okay. Yeah.
not actual games, but if you go to YouTube, you can see hockey fights, and they just put them on a loop. It's pretty fun. I really enjoy
You're
it.
you're you're like the person who watches NASCAR for the crashes,
No,
so
no, it's really fun. They have little rules that are, it's called the unspoken rule book about how to conduct themselves, and it's pretty interesting. Um,
every sport has an unwritten rule book.
well, but this is like a hit squad, and they're committing crimes, and everybody kind of looks away because technically it's against the rules, and then they penalize them. But the crowds like it so much. No, it's a formalized. It's a strange activity. That's what it is.
I think the word crime is perhaps a bit hyperbolic. This isn't villainy that we're seeing here. This is simply it is a it is a system of rights and responsibilities
Yes.
carried out by the individual members of teams.
Okay. And everybody accepts that justice. They can get, so if you hit somebody over the head with a stick or slash them, there's going to be repercussions beyond the little penalty box that the ref gives you.
There's going to be consequences and repercussions. Yes,
But I mean, some
that
people,
has happened. That has happened where someone,
yeah.
I remember Dale Hunter high staked Pierre Turgeon of the Islanders. And there was the official punishment, and then after he was allowed out of the sin bin, there was perhaps more punishing consequences. So
Well, it's sort of strange because they have these enforcer types who, from my understanding, they'll just talk to each other casually before the game, say, we're going to fight, right? Yeah. And how about right after the first face off? Okay. And then they go out there and drop the gloves and do it, pat each other on the back and go to their. It's sort of a formality, it's odd, is what it is.
it's a gentleman's agreement.
they drop they drop their gloves, they take their headgear off. They wait for the other person to do it, and they don't hit each other when they're down. And uh, yeah,
I will tell you, as a fan, as a person who's been a fan for a long time,
yeah.
my first exposure to hockey being the East Coast Hockey League, which was very much a kind of a goon hockey league. The role of the goon has changed a great deal in the last 20 years. I don't think you see much of the goons nowadays. I mean, even the goons have a good bit of skill. You back in the day, a goon could barely skate, and he was just out there for he was just out there for one reason. It was to start mischief. But nowadays, you have to have some sort of you got to have some skins on the wall. You got to know what you're doing. You can't just go out and be some knuckle dragger.
Okay. Well, it's really strange to figure it out. I still don't know what icing is, but it sure is exciting when they drop the gloves and uh, size each other up and then grab each other's jerseys and they punch with no leverage because their feet are sliding. And Mr. Miller pauses, so I'll stall for a minute before he responds to the idea of sliding people on the ice, which is kind of what skating is sliding on the ice, if you come to think of it.
No, it's controlled sliding.
Oh, okay. Well, I think that's what's happening to our podcast. We're kind of sliding into something here. What's our destination? What are you thinking here, Miller?
Well, we could what I'm thinking about is the medical profession.
The
Speaking of, fights and having to then patch up the people afterwards, um,
well, it's funny you say that because I am a doctor here, Miller.
I don't think you're that kind of doctor.
Uh,
I t I
Okay.
tell you I tell you a cool story about doctors and hockey. Do you wanna hear it?
I'm just waiting for this. That's why I got up this morning.
Okay. So, I think it was 84, 85. The Buffalo Sabres were playing someone of no consequence to the story. I think it was the Rangers, but I'm not sure. But back in those days, the goalie's mask basically just comprised the face mask. There wasn't anything, today it's a very complicated, convoluted, all-encompassing sort of thing where you really couldn't hit any part of the head if you tried with today's goalie mask. But back in those days, it was just the front face mask. And the I think it was the Rangers, they were trying to score a goal. They crashed into the Sabres net, and one of the Rangers players, his foot came up and his skate cut the carotid artery
Oh
of the
no.
goaltender. And the first thing you see is you just see all this blood pouring out onto the ice. I mean, I mean, there were players throwing up. It was horrible. One of the guys in the stands was a Vietnam combat medic. Goes down to the ice, is able to well, first they were able to get him into the dressing room, and then second, he was able to find the artery that had been cut and then hang on to it. Because apparently what happens is if the thing is disconnected too long, it'll just sink back into the throat and then Bob's your uncle, you're dead. But he hung on to those two pieces of the artery and held it all the way to the hospital until surgeons could reconnect it. And I think the guy was back on the ice about 2 weeks later.
Yeah, that's
But
what happened. Well, so that's a great example of what the profession of medicine can do.
well, sure. I mean,
I thought it was going to be a story where they messed up and the guy broke his hip and ended up doing surgery for something entirely different.
yeah. No, but his name was Clint Malarchuk, and he
Malarchuk, the
survived it. So
player or the
the
doctor,
player was named Clint Malarchuk, and
and who
so
was the doctor?
no one knows.
But you seem to think it was against the Rangers for some reason.
I think it was the Rangers. I don't know.
Okay, well, let's call the doctor 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 something.
Well, I just find the reason why I thought about doctors was, the last couple of years I've had experiences with doctors for various things, as someone in their 50s are bound to do. And I do find myself, first of all, so according to somebody, there's around 1 million physicians that are in practice in the United States.
1 million?
Yes.
That's a lot. That's a quite a number. If you think, what do we have? 340 million people, something like that,
Yeah.
and 1 million of them are doctors.
Physicians. And I don't know the difference between what they would call a physician as what they would call a doctor.
Yeah,
When I
but
think about
MD.
physician, I think about the primary care physician.
Well, so in the medical profession, we probably have a nice chunk of our population fixing us up.
Fixing you up?
Fixing us up. You're searching the internet now, Herr
Well, no,
Miller, looking for
I,
statistics.
I I only have certain statistics available on hand.
You could do an Ask Jeeves search and find out from the World Wide Web, Herr Miller.
Last Jeeves hasn't existed in like 30 years. No one wanted to ask Jeeves, and so it went away.
Yeah, it's much better now, isn't it?
But I'm curious about. Here's what I'm left with, and I'm curious as to your reaction. Is that I go to the physician, and I feel like that I am an impediment on their time. that they're so busy that they have to deal with me in as quick of a time as possible. Is that just me? Do I just have a bad doctor, or is that your experience as well?
We had the same doctor, and she seemed to really like me. I was telling jokes, entertaining her, entertaining the staff. She'd bring in, these physicians' assistants and people, college students. Say, get a load of this guy. He's really funny. And so, no, I mean, I would say that with my personal doctor, she takes a lot of time and she'll listen. And I think, boy, nobody listens to me like this. But she actually is attentive and not rushing. And I think that that's a style of doctoring that we need, 'cause it does make a big difference, particularly if they make you wait and then you made wait again, and they try to keep you busy by doing the blood pressure and all that stuff, and then you're waiting, and then they're talking outside the door, they're there, you hear their voice, and they knock and come in and shake your hand maybe, and then I guess that sometimes I feel like I'm treating myself, coming up with the story and the down to the prescription, and, they tend to believe what I say a little more than I would like.
Maybe if you weren't a doctor.
Well, yeah, I use that joke too, any chance I get. But no, I think I'm at my funniest when I'm in the doctor room and because they have it's perfect for comedy because they have the nurse there always. They don't leave you alone with them, and sometimes they bring somebody who's in training in there too. And so if you're a little bit offhand and you know giving some kind of unexpected remarks, it's easy to get a chuckle out of people. And what's more important than that?
Something like jumping up on the table and start chanting Attica.
No, that's not it at all. Um, um, but you're saying that you feel like you're in you're using you're part of their day and they don't really want to spend too much time with you. So they have a few minutes and then once they feel like they've hit enough time, they send you away, take your blood and get you out of there. But you don't feel like they're attentive enough.
Well, I think it's a crapshoot because if you find a doctor that's very attentive, it almost gets to the point you're asking yourself, does she have other patients? Does she have,
You can't be
because
pleased at all now.
well, I'm just saying that's my point. My point is that I'm sure there's a fine line somewhere. There's a happy medium, but there is such an idea that if they spend a lot of time with you, you're like, man, do they have a lot of patience? Am I with the best doctor? Because you would think that the best doctor would have the most patience, but then the trade-off is they have less time for you.
So have you ever done a teledoc appointment?
No,
What do you mean
even
no?
during COVID, I wouldn't do that.
No, they are great and they're perfect because the waiting room is basically your computer room, so you can like work while you're waiting for them. Then they open it up and they come in, and usually they're right on time. I mean,
Here's my thing
95%.
about here's my
They're
thing
not
about
gonna, but they're not gonna examine you for most of the things that get to us at our age. We don't go in there with broken arms or things. We have internal issues that are basically diagnosed by a blood test or an X-ray, and so they're not going to do those in the office anyway. So why not do them virtually?
here's my thing about the teledoc, whatever it's called, doc in the box. Who knows? I don't know. But the thing is that I don't crave never leaving my house. I like getting out.
You like
I
going to
like
the doctor, sitting in
well,
the,
for anything. I mean, it doesn't mean that I only go to the doctor. Maybe I go somewhere else, but you're just talking to people. You're interacting with people,
you know them
and I
there. You know that you say hi, Madge, to the woman who's the assistant up front. The John,
Madge,
the custodians there, and you give them a nod. Ross, how are you doing? I mean, do you know everybody there? Is that where you want to go?
Madge. This isn't
Just came to my mind.
1940. What do you mean?
We're not the 1950s. It's a great name.
No, I know some of the nurses, and I know some of the staff that works on the front desk.
Yeah.
I sort of know my doctor. So I mean, just but yeah, I know the people. I know the phlebotomist. So
So you like going out there. Um, I
well,
mean,
it's not that I like going to the doctor, but if I have any choice in the matter as to whether to do something online
Yeah.
or do something in person, I think I'd just prefer to do something in person.
So we're like doing this podcast online right now. We think about it. And it's great because I can like work while we're talking. Yeah.
It's one of those things where I'm always kind of conflicted with, as far as the doctor experience goes. And I know that that's just part of it. But
Well, that's the family position part. I have no complaints. I like the office. The person who takes blood is usually very efficient. They're respectful of time. I don't feel like I'm waiting too long, and it's gotten better and better and better. Um, Now, the more serious things where you have specialists and that that can get a little bit
surgeons,
dicey. Yeah, sir. I mean, we've been both of us have been to surgery. They know what the heck they're doing there too. I mean, they have you asleep before you know it, and then you're sitting there in the waiting room.
I do. I have finally had my first surgery, so I do know. Although one of the things I always worried about, it is said that doctors leave sponges and other medical devices inside of their patients about 6,000 times a year.
6,000?
6,000.
Um, well, some of them aren't really that dangerous. I mean, these other things could be, um, who knows what, but rings and sponges and weird things. I mean, they're
It
in
can't
there
be
doing a
good
lot
to
of
have
work.
something. It can't be good to have something in your body that doesn't belong in it.
I bet if we had a doctor on right now, they could set us straight on that. And it's like a wives' tale. You're
I
bringing
thought
up
you were a doctor.
what's that?
I thought you were a doctor.
No, that's why I'm debunking this. Unless you have hard data,
Okay. Medical errors are counted as one of the leading causes of death and injury in the United States. It is estimated that about 98,000 people die each year in U.S. hospitals as a result of a medical error.
so you put on your statistician voice, and supposed to be authority or something. It's just you talking still. 9 out of 10 doctors say. uh,
And someone has already tried to figure out a way to get people not to make mistakes because a study performed in the US found that surgeons who play video games on a regular basis make 37% less errors and were 27% faster than their non-gaming coworkers.
well, because most of these surgeries now are done by robotics. You have a robot doing it. I like to think that they have their hands in the gloves and then they're watching their screen or something. But they could be moving a mouse for all we know. And the robot, or they just talk to the robot and tell the robot what to do. And so you could blame the robot, not the surgeon.
I don't trust any of it.
Um, you seem
Listen, for
you're
me,
coming in a little bit hot against the medical profession that they've saved our lives multiple times. If you think about our personal circumstances, I mean, if they've extended the years, we would have not been here. Maybe it's quite possible.
no, I'm not coming in hot against the medical profession. It's just that I mean, when you think about going and having the medical experience, going to seeing a nurse, go seeing a doctor, or what have you, and I've seen my share because for whatever reason, as you know, I've had some pretty peculiar ailments over the years.
Well, it's because of your lifestyle and quite frankly, your sordid past before we even knew each other.
Let me tell you an example of the errors that I have dealt with as on the part of physicians.
Yourself?
Yes,
Okay. Did you
and
make
it's
a
and
list?
it's not that this experience leads me to believe that all doctors are equally incompetent. That would seem hyperbolic. I'm not going to do that, but they certainly can make mistakes. So as you remember, about 12 years ago, 13 years ago, I had meningitis.
That was serious.
It was serious. You had to get up in a full hazmat uniform before you could come into my room.
I know, that was pretty cool. I brought
It
you
was an
like
anti I had an anti room.
yeah, and I brought you a pastrami sandwich, I think, somehow through
Yeah.
all that.
So when I was originally taken to the hospital, I was in the emergency room And for those of you who don't know, when you're suspected of having meningitis, one of the first things they do to verify and to categorize the ailment is they do a spinal tap.
Mm. I'm making noise because it's supposed to be incredibly painful. I've only heard of it.
It's made more painful if the person doing it doesn't know how to do it.
Well, they put a needle in your spine. Is that right?
Yes, and so what they're trying to do is they're trying to hit a sweet spot somewhere in your spine where they can take out spinal fluid. Because meningitis, for those who don't know, it refers to a swelling of the brain. And apparently, whatever causes that to happen can travel up through the spinal cord, and it's in the fluid of the spinal fluid. And so she tried to do it in the emergency room, and my wife's sitting next to me, and I'm like hollering every time she's putting the needle in. And one time I hollered and she goes, "It's not even in yet." And she's like, she's giving me shit. She's got a needle in my spine.
Well, but she's just barely put it in. She hasn't like penetrated into the spine itself to get to the fluid. Um,
Listen,
uh,
it doesn't take much penetration to cause pain when you're talking about a needle into the spinal cord.
which part of the
Eventually,
spine is it? Is it like low or high?
low.
Like, wow.
I mean,
First,
not like in the tailbone, but like in the
yeah,
lower third of the back, I think.
that's a terrible
And so
name
what
for
and
a terrible name for a band, by the way. I mean, thinking about this is Spinal Tap. What a terrible band name. I love it.
but anyway, so they ended up taking me to the X-ray, and then some other guy did it with an X-ray. Bim bop, Bob's your uncle. It was fine. I didn't even feel it, And so, you know, part of my part of my experiences lead me to believe that perhaps doctors have the same percentile of incompetence as any other field of endeavor.
Sure.
And so the problem is that's what you end up having to deal with.
Well, you were talking about a nurse who does
No, she was an ER doctor.
an ER doctor, but
Yeah.
she was doing it blindly without the video.
She was doing it straight there on the bed. So
Oh, well,
she seemed to think she didn't need any help.
okay. So
I
this,
suggested different.
so you're kind of generalizing from this one event that they're making all these mistakes with other people too.
No, but I do wonder how often the mistakes happen, and is it a question of? I mean, it goes into how many doctors we have, how many patients we have. Is it possible to have competency at even a passing level across the board when you have to have so many people doing these various kinds of jobs? And it just makes you wonder, what your doctor experience is compared to other places. Now, we don't need, you know, I know there's a lot of my friends, they'll get on their soapbox, talking about how great Canada's system is. I think our system's fine.
Yeah.
It's just a question of, there's some realities to it that can make things a little bit more complicated and less effective.
Well, the number of decisions that doctors and healthcare workers make is astounding. They're making all these little decisions and think about all the things that they're getting right during that time and all the people they're helping and they sometimes have more people. They don't know how many people are going to come in there and they
Mhm.
so I think based upon the pressure they're under, I've been always more than impressed, and it seems to be they're treating people better, if anything, more recently than they used to.
And technology probably has something to do with that as well. Their ability to be able to anticipate things, their ability to be able to perform certain procedures that perhaps not even 10 years ago they could do.
So another issue, forget surgery and all of that, um, the rough stuff. What about the willingness to prescribe and pass out pills for anything? It does seem like you can come in with a good story and you'll get some good pills, and the the default is always to treat the symptom and to give you medication and send you happily along your way. And is that actually health care?
Well, I would say that perhaps nowadays that's less seen. You know, there used to be, I mean, I think doctors used to prescribe OxyContin like it was Tic Tacs. I mean, I don't think that that level of promiscuous pain medicine prescriptions are as prevalent as they were.
Well, it's addictive and really dangerous.
Right. I always thought about doctors. Did you ever think doctors only promoted or prescribed certain drugs because they were getting some sort of kickback from pharmaceutical
Oh,
companies?
I assume they were, yeah.
Do you think that still happens?
Sure. I mean, who are those people who come in, those representatives? They create relationships with them and they have choices between generic and all these different things that essentially do the same thing, but they have different names. So I think it's part of it. And I don't know if the individual doctor, I mean, the practice will get a kickback, I'm sure, but that's just doing business.
Well, I remember reading somewhere that said that doctors are not usually paid to promote a certain drug or device to the patients that they're treating, um, saying despite popular belief. But what do they mean by paid? I bet you it happens on a bunch of different levels, either money or perks or I mean, are we right to be suspicious of the kind of drugs doctors think we should take?
I think that someone needs to advocate, for the people who are paying exorbitant prescriptions. So this is a bigger issue, the drug prices. Um, but I mean, they can prescribe something, and you can say, "No, I'm not going to do that. Can you prescribe me something else?" So I think a lot of people are not advocating for themselves, and will just listen to their doctor on everything.
Do you think that um do you think that there should be pharmaceutical commercials?
I think there are, aren't there?
There is a veritable plethora of them, at
Uh,
least on American television, but that's not standard in other places.
Yeah, it is weird. I mean, we see beer commercials, and where but nobody can drink beer during the commercials. We see medicine, and there's a lot of fine print in those, and the production values are incredible. The acting is really bad usually with all of those. Not a no, this is a real person, not an actor. you know. Um, so I just think it's silly. I don't think they're very convincing. And when they start listing the symptoms and the things that can those side effects, I would prefer the sickness to the cure in most cases.
Well, I remember I was listening to a podcast with my favorite comedian, Nate Bargatze, and he talked about I think in the last 6 months, I've been seeing a lot of um, what's the word? Um, shoot. Now the name has escaped me. Um, it's a type of psychosis, is not multiple personalities, but give me something like that.
Something where you keep forgetting words.
But it was a ki it was a medical commercial for for a drug to treat an illness that you would think there's already something built in that people know to take this or the doctors know how to take this. It doesn't seem like a common enough or prevailing enough disease to warrant a commercial pushing the merits of one drug or the other.
Yeah, that probably has to do with politics and all kinds of strange things. Because talk to your doctor about this. I mean, somebody's going to write that down and say, "Hey, doctor, have you heard of this?" And you say, "Well, sure, thanks for bringing that up. I never would have thought about that until you mentioned it." Um,
But but it has to do with it just the notion that it seems like that there's a greater amount of emphasis placed, and this is perhaps solely on the pharmaceutical company and not necessarily on doctors, although doctors kind of help move these things along. But the idea that this is about trying to get people to be more aware of certain things, and but I just think it's creating more psychosis about what people have, and making people think that things may be worse than they previously thought.
Yeah, they bring up things I've never heard of. I start to worry. Do I have that too? Boy, I definitely have some of those symptoms. Um, well, so I do have a complaint.
All right, well, let's hear it.
Yeah, I've been kind of defending the profession, but there's a blatant uh, practice of
Did you
ageism.
say blatant or latent?
Not latent, blatant,
Okay.
blatant with a B. There's a blatant practice of ageism in the medical profession, and not ageism as far as promoting doctors and the good ones that are forced to retire. I'm talking about how they treat anybody who looks like they may have a gray hair in their beard, and they turn on that pretend voice like you're mentally retarded, and they use the royal we all the time, that so you fill out these forms for them, or they're, are we still living at this address? And I looked at her and I said, well, I know I am. I don't know if you're living there or not. And she didn't get the joke. And so then she asked again, are we here for this purpose? And I said, I am. Um, Nothing, crickets. And then I went into uh, to talk to the physician's assistant or nurse or whatever. And he started doing the same thing. He said, how are we doing today? And I said, well, I know I'm doing fine. How are you? And I said, there sure are a lot of we's around here, and it's just me here, just me here. And he stopped, but you need to.
You made him feel bad.
Well, I did, but I was getting annoyed because I'm not that old, and yeah, I have a little difficulty hearing sometimes, and I miss a few things, but they but I think that they speak differently
Or
to
they speak
people.
louder. They'll say, "How are you doing today?" And I'm like, "What? What is my did my dad just walk into the room? What are we doing?"
Yeah, but it's also the tone. I mean, it's like the elementary teacher voice, and it kind of pisses me off, and because I'm getting it more and more, and I've noticed that I have zero patience. I mean, I'm not a kind of a jerk publicly, but I hear that, and so my response is to the whole room. They're all listening, and I'll say, well, this we thing has got to stop. Doesn't everybody agree? I mean, it just it's a nerve because it's condescending to people who have all of these. I mean, I'm not going to claim rank here, but I know a few things more than a lot of these folks that are condescending to me, and I feel like once in a while you need to put people in their place. Because have you noticed this too, or is it just me? And
See,
the
I get a different kind. So
okay,
especially when I go to the doctor with my daughter,
mm,
when I go to her um primary care physician, her
yeah,
what is it called? Pediatrician?
yes,
Pediatrician, right?
pediatrician.
Yeah. All right. So when I go to the pediatrician, the staff will always call me um
Dad.
dad.
Yeah, I hate
And
that
I'm
too.
like, and I remember the first time it happened, I thought, I don't know what I thought, but I'm like, you can just call me Mr. Miller. I mean, what do you,
Yeah.
so I and my wife is the most conciliatory person,
Oh,
especially when it comes to public settings when she's worried that I'm going to embarrass her because I want to
she's
get angry
actually
or irritated.
she's actually nicer than both of us, to begin with. So I don't that doesn't surprise me.
Well, it goes to the notion that we marry what we lack. So
Yes, for sure. And we married
but
up.
she's like, well, Ross, it's better than them, trying to keep track of what your last name is. I was like, it's in the chart right in front of them. They have the last name of the kid.
Oh,
Just call me Mr. I'm not
you
your
could be
dad.
not you could be a guardian with a different name. You could be an uncle. They're presuming that you're a mister to begin with, you know. All these things
Let's
come to mind, and so they just call you dad. And
well,
you
see,
but your kid doesn't even call you dad.
no, she doesn't. First of all, she doesn't. Second of all, she calls me Ross. No.
Oh, father.
Oh, Mr. Miller, but no, it's just you would think that for as many different possible scenarios of child caring that there could be, that the one thing you don't depend on is saying dad or mom to whomever, whatever adult brings the kid in. Just call them by their last name.
That's
Let's
everybody.
do that and see if it works.
Even the doctor will address you as dad, and and I mean, we're equals in the room. That sounds a little bit weird, and particularly if it's like a female doctor. And it's just there's just much baggage there. I agree with you. So it's just as condescending. But it's the same tone, and
It's the
just
same tone, yeah.
they're taking liberties, something you don't like and I don't like equally. With the
I
formality, it's way too informal.
it's too informal. It assumes too much, and we've talked about this before. It's I think for both of us, it is a pet peeve that sends us right up the wall. It's like
Yeah.
it when the gym workers call you Ross when you check in. Hey, Ross, have a good workout. Try Mr. Miller. But
I said that to a lawyer once when I was being questioned for jury duty.
what'd you call him?
They mispronounced my name first of all, and they said Mr. Burgoyce or something weird, and I said that's doctor with a pause, Doctor Bourgeois, and swiftly I was not put on the jury, but it bugged me somehow, the Mister and then just the mispronunciation, and I would think about authority, maybe I don't know.
I think it's another element that kind of drives me crazy. And again, we're saying all this with the understanding that medical advancements, technologies are amazing. That there's millions of healthcare workers doing amazing things, but most of those folks I don't see on my regular trip to the doctor. Not that my doctor's office is filled with morons, but um, it's just there's like little things that like drive you crazy, and you ask yourself, is this something I should just deal with, and that it's no big deal, and I'm making too big of a deal of it, or is it something that requires further inspection?
Well, have you ever left during a doctor's appointment? Like walked out?
I ever walked out? I don't think so. Have you?
Yeah. It was a good moment, but I went to a chiropractor, and the, I didn't. I thought it was more of a consultation, talk about the idea, and they started working around a little bit, and then made me go to another room and sit on this strange bed. It had this weird thing that supposedly is supposed to be really good for you, and uh, I immediately said that I thought we were going to have a conversation, but I didn't agree to anything. And so I went up to the front desk while I was supposedly waiting in the room playing on that wheel, the rack that they gave. And I said, the appointment is over. I'm leaving.
Were you that formal about it, or
Yeah, yeah. I said the appointment is over. I'm leaving. Those are my words. But no, I have a weird thing about chiropractors. Um, any adjustment.
but you went to one?
Well, it's a long story. I was asked to go.
You're
Yeah,
asked to go.
but the office is important. I think that's the what we're getting at a little bit is you're in a bit of a vulnerable position, particularly if you think there might be something serious wrong. And so how they treat you makes a difference. And yeah, I've gotten pretty annoyed in waiting rooms. Things are taking a long time, and that you know you shouldn't have to wait that long because that's a scheduling problem that's on them. They shouldn't have scheduled you at that appointment time if you're going to wait an hour in the waiting room. Let's pick a different time. They can't be that
I've
busy.
never had big problems as far as like wait time.
Yeah.
But I mean, but just the idea of the degree to which you felt like someone was in there with you who gave a rip. And it's not that people in a hurry don't care, but they have less of an opportunity to show it, and I don't need someone to disagree with everything I say. I don't need someone to disregard everything I say. But, but it feels like that the doctor patient interaction should be more of a relationship than I think it is, at least for me. I don't need to know about their dreams, hopes, and aspirations, but I want there to be a give and take where my doctor has a sense of me. And so when I bring something up, they can make decisions based on not just what I said, but contextually what they know about me. And again, it's hard. If you've got like a shitload of patients and you're seeing like 150 people a week, how do you keep any one person straight? I don't know if what I'm asking or what I'm wishing for is not something that's practical or possible.
I think that there's a little bit of the joke that for somebody with a hammer, everything is a nail. And so you go into their office and their treatment is what you need. You go to a rheumatologist, it's a blood issue and you get a prescription. Everybody has their idea. You go into an ear doctor, and what do they call them? Ear doctors. And they're gonna suggest that you need a hearing aid. You know, so you go through the little test, put your fingers up and everything, and sure enough, oh well, you definitely need this. I mean, I went in there for tinnitus or
Yeah.
tinnitus or whatever, thinking that they might have something at some point that could help, and they're saying, well, no, you need a hearing aid for that. And I said, well, first of all, I'm not getting a hearing aid. And anything beyond that is not a conversation. But then we kept talking about it anyway. I said, no, I'm not going to do that. I prefer to not do that, at least just yet. We'll talk later. But then if that wasn't and enough, I went to the front desk and they said, so when are you coming in to try on these hearing aids? And I said, well, about 2 minutes ago, I told the crew in there that that wasn't going to happen, and I'm going to tell the same thing to you. I don't think you got the memo or something. And so I get a little short with them, and so I think it's once again they get a little bit presumptuous, and they think that their area is always what you need.
Right. So I think in short, I mean, we're talking about a medical profession that maintains its relevance by maintaining their patients. And, that includes, assuring them that their patients do have something that needs to be taken care of right away or what have you. I think you have a pharmaceutical industry. By the way, schizophrenia was what I was trying to think of before.
You're
So
just saying it now.
imagine a commercial about a medicine for schizophrenia.
Yeah.
Talk to your doctor if he's really there about schizophrenia, and the idea of it would just seem like schizophrenia is the kind of problem where they're good, they're set on their medicines. They already know what kind of medicines they need. And does a schizophrenia patient are they even listened to when they say, I think I need this drug? You know, I it's the way they explained it on the podcast that I was listening to was like they were portraying the commercial was portraying schizophrenia like someone had the cough or a cold or COVID.
Yeah,
If you have any
makes sense.
symptoms, talk to your doctor about this particular medicine. And it just seems like schizophrenia is a little bit more of an important ailment than just whatever else you might have a commercial for. So it just seems like there's a lot about the medical profession, and I don't want to go to Canada, so no one start yelling at me about how good I have it here. I
I,
know
ne-
how good it
I
is here.
never brought it up. I never even thought about it.
But anytime you talk about doctors, well, do you want to be in England? I was like, well, no, I. Hmm. But I mean, but there are some things that could certainly. There's better ways of doing certain things, I would imagine.
So I would say for people who are in their 50s and 60s and getting older that you don't want to miss those annual checkups. You know, they
Right.
and they have some procedures that you have to do about every 5 years, and um, but they also do these blood tests, and
Hmm.
incredibly important. And I can say that I had a early diagnosis for something that could have been quite serious, and managed to put some years on my life because of that early diagnosis from a single blood test. And so you never want to miss those annual checkups, um, because they're getting more and more complete, and they're very easy, and you get this complete screening. But there's nothing wrong with that. I think we've gotten better about if you want to, I mean, I work in data, I work in dashboards and apps. And if you want to see a really good app on your phone or look at the medical app and how well they present those tests and the historical longitudinal data,
Hmm.
interpretations, everything. It's brilliant. It's clear. Anybody who's doesn't have a MD can understand it. You can drill
Hmm.
down. So it's come a long ways, so medical records, it's becoming digitized, and but that's a way to have preventative health and involve the patient. So it has gotten more collaborative on that side, because before they just held on to your chart, and you had really no idea of these trends.
All the problems that we've talked about with regards to, the issues dealing with doctors and primary care physicians and all that other stuff, it pales into comparison to the problems that you would face if you did not go to a doctor on a regular basis. I do my checkup once a year,
Yeah,
and anybody who says I don't go to doctors, well, you're an idiot. I know that there are reasons why some people don't go to a doctor, but I think on the whole, you're better off than you are worse off by going at least doing the annual checkup and the blood tests that you were talking about and all the other tests that they do once a year. It's once a year, for God's sakes. Man up.
it's
Just go to the doctor. What are you doing?
really, really. Well, sometime we'll have a follow-up on the dental profession, but I think that uh, we'd probably get a few more laughs out of that one.
Oh my God, the dental profession. Now we do got to do that now. So, but
Yeah, let's give that a year or two if we're still around, and we'll leave that case closed for now.
unfortunately, my experience of the dental profession was heavily marred by the psychosis that my father had about dentists, and
Did
so
it? Okay.
I was not set on a good path from the get go.
Well, we may have to talk about that, because I've been on their watch list for years, and so if they get me on the phone, they're instructed to make sure that you send a car over and get him.
Whatever you do, keep him on the phone. It's like a negotiation or something.
Yeah, he's a flight risk. That's right.
we we have his we almost have his location zeroed in on. So all right, well, enough of the silliness. Doctors, thank you everybody for listening. We
Yes.
appreciate it. And I shall say adieu, Herr Dr. Bourgeois.
Wieder sehen, Herr Müller.